Hello, this is our second session on the anatomy of the facial nerve, having reviewed the intracranial course, the extracranial course, and the branches of the facial nerve, and an in-depth exploration of the motor functions of the facial nerve in the first session. You're advised to look at the first part of the anatomy on the facial nerve before going through this part. The learning outcomes on part B of the anatomy of the facial nerve are as follows. We shall review the anatomy of the nervus intermedius, root of the facial nerve, that is the sensory component. We shall also review the cranial parasympathetic ganglia of the head and neck, and we shall look at the role of the nervus intermedius in conjunction with coda tympani as a special sensory nerve to the anterior two-thirds of the tongue. And finally, we shall explore the clinical significance with reference to the branches of the nervus intermedius. We shall start with a quick recap of the main components of the facial nerve. We've already discussed that facial nerve provides motor innervation to the muscles of facial expression, some suprahyoid muscles such as the posterior belly of the digastric and stylohyoid and stapedius. We also know that the facial nerve branches provide parasympathetic innervation to the lacrimal glands, salivary glands, and mucus glands in the oropharyngeal region. And finally, the facial nerve is responsible for providing gustatory innervation to the anterior two-thirds of the tongue. You've already seen this image in the first presentation, that the main components of the facial nerve are a large motor root and a small sensory root or nervus intermedius. And these two roots join together and form the geniculate ganglion in the facial canal, and three branches are given off at this point: the greater petrosal nerve, also known as the greater superficial petrosal nerve, the nerve to stapedius and coda tympani. And then the facial nerve gives off three other branches: the posterior auricular nerve, the nerve to digastric, and the nerve to stylohyoid after exit from the stylomastoid foramen. And then it enters the parotid gland to give off its terminal branches on the face, which are the zygomatic, the temporal, the zygomatic, the buccal, the marginal mandibular, and the cervical branches. At this point, we shall have a brief overview of the parasympathetic ganglia associated with the cranial nerves. So there are four parasympathetic ganglia which are associated with the cranial nerves, and it is customary to describe these ganglia with reference to their parasympathetic root, their sympathetic root, as well as their sensory root. Remember, only the parasympathetic nerve fibers synapse in these ganglia, and the postganglionic fibers are distributed through branches of other nerves which are specific to each ganglia, and we can look at these individually. Firstly, the ciliary ganglion. The ciliary ganglion is associated with the oculomotor nerve, which is the third cranial nerve, which provides the preganglionic parasympathetic fibers, which are distributed through the nasociliary branches of the ophthalmic nerve, which itself is a branch of the trigeminal nerve. Then we have the pterygopalatine or sphenopalatine ganglion. The preganglionic parasympathetic root is derived from the greater superficial petrosal branch of the facial nerve, and the postganglionic fibers are distributed through the zygomatico-temporal branch of the maxillary to the lacrimal gland, and through the ganglionic branches to the mucus glands in the nasal cavity, the palate, pharynx, and the orbit. Third, we have the otic ganglion. The preganglionic parasympathetic fibers are derived from the lesser petrosal branch of the glossopharyngeal, which are then distributed through branches of the auriculotemporal nerve to the parotid salivary gland. And finally, we have the submandibular salivary gland. The preganglionic fibers originate in nervus intermedius of the facial and are distributed to the submandibular and sublingual salivary glands through the lingual branch of the mandibular division of the trigeminal nerve. Now we shall look at each of the four parasympathetic ganglia in a bit more detail, starting with ciliary ganglion. Even though the ciliary ganglion is not correlated with the facial nerve, we shall review it for the sake of completion. The ciliary ganglion is located in the posterior orbit. The parasympathetic route is provided by the oculomotor nerve. The preganglionic parasympathetic fibers originate in the Edinger-Westphal nucleus in the brain and enter the inferior division of the oculomotor nerve where they synapse, and the postganglionic fibers are distributed through short ciliary branches of the nasociliary, which is a branch of the ophthalmic division of the trigeminal nerve, to the ciliary muscle and also the sphincter pupillae. So remember, the sphincter pupillae muscle, which is responsible for constriction of the pupil, has parasympathetic innervation. The sympathetic fibers originate in the superior cervical sympathetic ganglion, and they are basically postganglionic fibers which are distributed through the plexus around the internal carotid artery. They pass through the ganglion without synapsing and are distributed through short ciliary nerves, branches of the nasociliary of the ophthalmic of the trigeminal, to blood vessels of the eye, and through long ciliary nerves to the dilator pupillae muscle of the iris. So remember, pupillary dilatation is a sympathetic function. And finally, we have the sensory route of the ciliary ganglion, which is through the ophthalmic branch of the trigeminal, more specifically through the short ciliary branches of the nasociliary, and these branches are distributed to the iris, ciliary body and the cornea. So this image shows the position of the ciliary ganglion in the posterior part of the orbit behind the eyeball, and you can see the parasympathetic route is derived from the inferior division of the oculomotor nerve and distributed through the short ciliary nerves, and also the sensory route is distributed through the short ciliary nerves. And finally, you have the sympathetic route, which is derived from the sympathetic fibers around the internal carotid artery and then distributed to the local blood vessels through the short ciliary nerves and to the dilator pupillae muscle through the long ciliary nerves. Next, we look at the pterygopalatine ganglion or the sphenopalatine ganglion. This is closely associated with branches of the facial nerve. The ganglion is located in the pterygopalatine fossa, which is a blind space between the pterygoid plates posteriorly and the posterior surface of the maxilla anteriorly. The foramen rotundum, which transmits the maxillary branch of the trigeminal nerve, directly leads into the pterygopalatine fossa. The parasympathetic fibers related to the pterygopalatine ganglion originate in the lacrimatory nucleus of the facial nerve in the lower pons and then enter the nervus intermedius branch and then the greater superficial petrosal branch of the facial nerve. The greater superficial petrosal joins with the deep petrosal branch from the sympathetic plexus to form the nerve of the pterygoid canal, which enters the posterior aspect of the pterygopalatine fossa to allow the parasympathetic fibers to synapse in the pterygopalatine ganglion. The postganglionic parasympathetic fibers are distributed through the zygomatic branch of the maxillary into the zygomaticotemporal branch, which then communicates with the lacrimal branch of the ophthalmic on the lateral supralateral aspect of the orbit to convey secretomotor parasympathetic fibers to the lacrimal gland. Also, the parasympathetic fibers to mucous glands in the nose, palate, pharynx are distributed through the ganglionic branches of the maxillary nerve, that is the nasopalatine, the greater and lesser palatine branches, the pharyngeal branches, and the internal nasal branches. The sympathetic route is provided by sympathetic fibers around the internal carotid artery. These fibers are basically postganglionic sympathetic fibers from the superior cervical sympathetic ganglion and are distributed through ganglionic branches of the maxillary nerve to local blood vessels in the oropharynx, palate, nasal cavity, and the orbit. And finally, the sensory route of the pterygopalatine ganglion is provided by the maxillary branch of the trigeminal nerve, most specifically the ganglionic branches, which are distributed to the nasal cavity, the palate, pharynx, and the orbit. This image nicely depicts the parasympathetic and sympathetic routes to the pterygopalatine ganglion, which is located in the pterygopalatine fossa between the pterygoid plates and the posterior aspect of the maxilla, where it is marked by the pterygomaxillary fissure, which is colored in magenta color, and you can see the pterygomaxillary fissure in the image above. So the fibers originate in the lacrimatory and superior salivatory nuclei in the lower pons, then join the nervus intermedius, greater superficial petrosal nerve, which joins with the deep petrosal nerve from the sympathetic plexus around the internal carotid artery to form the nerve of pterygoid canal, which passes through the pterygoid foramen on the posterior aspect of the pterygopalatine fossa to join the pterygopalatine ganglion. The postganglionic parasympathetic fibers are distributed to two types of glands through the zygomaticotemporal nerve to the lacrimal gland and through the ganglionic branches, the orbital, nasal, palatine, and pharyngeal branches to mucous glands in these areas. And finally, the sensory route itself is provided by branches of the maxillary nerve. And on this image, you can see the zygomaticotemporal branch of the maxillary nerve carrying postganglionic secretomotor fibers to the lacrimal gland, reaches the lateral aspect of the orbit where it communicates with lacrimal branch of the ophthalmic division of the trigeminal nerve to convey these postganglionic fibers to the lacrimal gland. The third parasympathetic ganglion is the otic ganglion, which is located in the infratemporal fossa just below the foramen ovale, which transmits the mandibular division of the trigeminal nerve. The parasympathetic fibers originate in the inferior salivatory nucleus in the lower pons, then enter the tympanic branch of the glossopharyngeal to the tympanic plexus, and then finally to the lesser petrosal branch of the glossopharyngeal, which conveys these preganglionic parasympathetic fibers to the otic ganglion. The postganglionic parasympathetic fibers are distributed to the parotid gland through the auriculotemporal branch from the posterior division of the mandibular nerve, which is a branch of the trigeminal nerve. The sympathetic fibers are derived from the sympathetic plexus around the middle meningeal artery, and these fibers are postganglionic fibers from the superior cervical sympathetic ganglion, and they are distributed to local blood vessels in the parotid region. The sensory route is provided by the auriculotemporal branch of the mandibular nerve and distributed to the parotid gland. So this image shows the organization and distribution of branches from the otic ganglion. The fibers originate in the inferior salivatory nucleus in the brainstem, enter the tympanic branch of the glossopharyngeal, tympanic plexus, and finally distributed as preganglionic fibers to the otic ganglion through the lesser petrosal branch of the glossopharyngeal. The postganglionic fibers are distributed to the parotid gland through the branches of the auriculotemporal nerve from the posterior division of the mandibular branch of the trigeminal. Finally, the fourth ganglion, the submandibular ganglion, like the pterygopalatine ganglion, it is directly associated with branches of the facial nerve. The submandibular ganglion is located above the submandibular gland near the posterior border of the mylohyoid muscle. The parasympathetic route is provided by branches of the facial nerve. The parasympathetic fibers originate in the superior salivatory nucleus in the lower pons, enter the nervus intermedius of the facial, and then the coda tympani branch of the facial nerve. The coda tympani branch carries these fibers to the submandibular salivary gland, and the postganglionic fibers are distributed to the submandibular and sublingual salivary glands through the lingual branch from the posterior division of the mandibular branch of the trigeminal. So preganglionic through coda tympani, postganglionic through lingual branch of the mandibular. The sympathetic fibers, which are postganglionic fibers from the superior cervical sympathetic ganglion and condensed around the facial artery as the sympathetic plexus, are distributed to local blood vessels in the submandibular region. And finally, the sensory route is through the lingual branch of the mandibular nerve, which is distributed to the submandibular, sublingual salivary glands and also the minor salivary glands on the tongue and oral floor. So this image shows the correlation between the lingual branch of the mandibular nerve and the coda tympani branch of the facial nerve. The coda tympani branch carries preganglionic parasympathetic fibers to the submandibular and sublingual salivary glands, which are conveyed to the submandibular ganglion and distributed through branches of the lingual. This is another image which provides a summary of the three ganglia: the pterygopalatine ganglion, the otic ganglion, and the submandibular ganglion. And you can clearly see that the pterygopalatine ganglion has preganglionic fibers from the greater petrosal distributed through the zygomaticotemporal to the lacrimal gland and through the ganglionic branches to the palate and pharynx, etc. And similarly, you have the otic ganglion, the preganglionic fibers from the lesser petrosal branch of the glossopharyngeal and postganglionic to the parotid gland through the auriculotemporal. And finally, the submandibular ganglion, the preganglionic through the coda tympani branch and postganglionic through the lingual branch of the mandibular to the submandibular and sublingual salivary glands. Having reviewed the parasympathetic fibers in branches of the facial nerve to the lacrimal gland, the salivary glands and mucous glands in the oropharyngeal region, we shall look at the gustatory fibers in the branches of the facial nerve. So the nervus intermedius carries gustatory fibers from the nucleus tractus solitarius in the brainstem, and these fibers then enter the coda tympani branch of the facial, which then joins the lingual of the mandibular division of the trigeminal to provide gustatory innervation to taste buds in the anterior two-thirds of the tongue. So the general sensory innervation of the anterior two-thirds of the tongue is by the lingual branch of the mandibular, and special sensory or gustatory sensation is provided via the coda tympani branch of the facial nerve, excluding the taste buds in the circumvallate papillae, which are distributed along the sulcus terminalis. The taste buds in the uh, circumvallate papillae and on the posterior one-third of the tongue are innervated by the lingual branch of the glossopharyngeal, which provides both general as well as special sensory or gustatory innervation to the posterior one-third of the tongue. Then you also might be aware that there are taste buds present in the epiglottis and esophageal region. Now these taste buds are not directly concerned with taste sensation as such, but they are more for protection of the airway. When taste stimuli reach the epiglottal region or the esophagus, they can initiate a cough reflex. So the taste buds in the epiglottis and esophagus their innervation is provided by the superior laryngeal branch of the vagus nerve, which is the 10th cranial nerve. As far as the innervation of the muscles of the tongue are concerned, both the intrinsic muscles such as the superior longitudinal, inferior longitudinal, the transverse and the vertical muscle fibers, as well as extrinsic muscles uh, such as the hyoglossus, genioglossus, etc., platoglossus. They are innervated by all of the tongue muscles are innervated by the hypoglossal nerve, which is the 12th cranial nerve, except the platoglossus. The platoglossus is innervated by the pharyngeal plexus, which has contribution by the 9th, 10th, and 11th cranial nerves. In the end, we shall look at some of the important clinical issues. As you would be aware that the lingual nerve, the lingual branch of the mandibular nerve, is closely associated with the mandibular third molars, and it is found at a depth of 0.5 to 0.8 centimeters in the soft tissues on the lingual aspect of the mandibular third molars. And along with the inferior alveolar nerve, the lingual branch of the mandibular nerve is at risk of damage during surgical removal of the impacted third molars. And this is something which should be discussed as part of the consent for patients undergoing surgical removal of the mandibular third molars. Should the nerve be damaged, which can happen in up to 1% of the cases, it would lead to numbness on the anterior two-thirds of the tongue on the ipsilateral side, along with loss of taste sensation, because the taste fibers to the anterior two-thirds of the tongue, even though they originate in the coda tympani branch of the facial, they are distributed to the taste buds in the anterior two-thirds of the tongue through the lingual branch of the mandibular nerve. A rare but interesting phenomena related to damage to the auriculotemporal nerve is the Fraze syndrome, also known as gustatory sweating or auriculotemporal nerve syndrome. So this condition is characterized by sweating which accompanies salivation. So every time there is salivary stimulation, it is accompanied by ipsilateral sweating in the preauricular region. As you know, the auriculotemporal nerve carries parasympathetic fibers to the parotid gland, the postganglionic parasympathetic fibers, and also the sensory fibers to the skin in the preauricular and temporal region. Following parotid infections, surgery in the parotid involving the parotid gland, the mandible or the TMJ area, or trauma to the soft tissues in the preauricular area, there is damage to the auriculotemporal nerve, and in 6 months to 2 years, the nerve fibers they tend to regenerate and also innervate the sweat glands in this region. So every time there is salivary stimulation, it is accompanied by sweating in the preauricular region, and this can also be accompanied by a burning sensation, discomfort, and obviously social embarrassment when you are at a dinner table in a social gathering. So what you see in this image is a depiction of the starch iodine test. So to confirm the presence of sweating during salivation, the area is coated with yellow iodine solution and covered with white starch powder. Then the clinician would uh, stimulate salivary secretion using citric agents, and should there be gustatory sweating, the presence of moisture will activate the iodine uh, and convert it into a dark blue color, dark blue or brown color, which then confirms the presence of moisture, i.e. sweating in the preauricular region. So this is a diagnostic test for Fraze syndrome. A very similar phenomena is gustatory lacrimation or crocodile tear syndrome. This is a rare phenomena that may follow Bell's palsy or other forms of facial nerve damage, and the gustatory branches of facial and glossopharyngeal nerves following damage as a result of Bell's palsy or other conditions tend to regenerate and are misdirected through the greater petrosal nerve of the facial and reach the lacrimal gland. So just like we saw in Fraze syndrome, every time there is salivary stimulation, it is accompanied by lacrimation or tear production. So you can again understand the element of social embarrassment if you are at a dinner table and people might ask you, why are you crying when it's supposed to be a happy social occasion? So this is what we call gustatory lacrimation, which is salivation accompanied by ipsilateral lacrimation. So for further reading, I would recommend these two texts, the Netter's Anatomy of the Head and Neck for dental students and also Physiology for dental students by Wiley Blackwell. Thank you.